Hello and welcome to What Would Larry Do? I am Dr. Ann and I'm here with Larry Hellwig on this gloomy morning in Arizona.
Good morning.
Good morning, and we have a special guest with us today. So today on our show we have Dr. Jen Haley. Dr. Jen is a board certified dermatologist since 2004. She also served as an officer in the United States Navy and was actually selected as a VIP dermatologist consultant to the U.S. Capitol in Washington. She has traveled and worked all over the world and worked with all types of skin, and she's an expert injector and a sought-after teacher in the aesthetic industry. So welcome to the podcast, Jen.
Thank you. So glad to connect with both of you. I always love collaborating and sharing good information with both of you. I learn so much every time.
Good. Good. So we have some fun stuff to talk about today. A lot of skin stuff, right?
Yeah, super exciting.
Okay. So
Dry skin. Dry skin.
That time of year, isn't it?
You know, all of our out-of-staters come in, and almost immediately it's like, what do I do about this? So I think it's a great topic because they're all dried out like a prune in no time. And so what to do, where to go from that, but that's common.
Well,
Right.
and not only that, but I love that we're going to talk about as well that it's everything that you do external, but you also have to look at the internal. And I think a lot of times people forget that skin's an organ and it's the largest organ in our body. And that if anything you do to yourself internally will show up on the skin externally.
That's right. If I recall, it's the size of a curtain.
You mean
a shower curtain?
a shower curtain.
A shower curtain. Maybe a large one. Okay.
All right.
Absolutely. That's why I think the skin is so fascinating because it's really a good indicator of what's going on inside the body, right? So if your skin is inflamed, typically all your organs are inflamed. And the skin produces something called natural moisturizing factor. And what you're seeing when we have these winter visitors and they're coming from more humid environments, is their body is acclimated to a higher humidity. So they come here and it takes about 2 weeks for the natural moisturizing factor to adjust, 2 to 4 weeks, depending on how old you are. So the first 2 weeks can be really rough. And that's when eczema, dry skin, hand dermatitis, we see a ton of that during, overwashing and the hand sanitizer and things like that. So just to have your body adjust to a new climate can often take a little bit of a while, but then seasonal changes take effect as well. So what you're doing in the summertime when there's more humidity is going to be quite different than what you do in the wintertime when there's lower humidity in the environment.
Mm-hmm. Absolutely. No, we see that seasonally all the time. It changes so much. And in Arizona, you would think being in the desert that the summertime would be the driest time of year, but it's the winter out here. So every
Yeah.
time when people have the dry hands, they're cracking from washing them. So the first topic we kind of want to dive into is adult acne. Definitely since COVID, we've seen a lot more issues with that as people would have the maskne and skin breaking out. I mean, we've been dealing with patients that have had adult acne for years, but let's kind of start with that as our topic. And you can tell us a little bit about that, Dr. Haley.
Sure, sure. Can I just take a step back with the dry skin?
Oh, yes, you can.
Some of the pearls are super easy. What we often do is we overwash. So all of those commercials that we grew up with where we're taught to suds up from head to toe are wrong. We really don't need soap per se, especially not a harsh soap. We want to look for cleansers and use them in the areas of the body that produce scent, under the arms, the groin, the feet. Arms, legs, areas that don't have a lot of oil, all you're doing is stripping the skin of its natural moisture and the natural oils that are protective, that help the skin barrier be maintained to protect us from environmental allergens, from dryness, from basically infections, things like that. So we don't want to overwash. When women shave, often I find that they're shaving with soap, and I'll see little red areas around each hair follicle, and that's an indicator of significant irritation around the hair follicle. So I'll often recommend just back off on the soap. That's the easiest thing we can do. And then the minute you get out of the shower, you want to use a moisturizer with ceramides, an over-the-counter moisture with ceramides. And if you want to go the natural route as far as oils go, good scientific research has shown that external use of sunflower oil can help
Mm.
improve the skin barrier. It increases the natural ceramide production. So if we think of our cells as being little bricks, the ceramides are the mortar that connects the bricks to protect us from the outside influences and toxins. And sunflower oil is also anti-inflammatory.
Oh, wow.
Olive oil, on the other hand, we don't want to use. It's very highly inflammatory, promotes the growth of yeast that we're going to talk about later, and also increases water loss. So stick with sunflower oil. Coconut oil is great, not for the face because it can cause acne. It can be comedogenic, which we'll also talk about. And jojoba oil, which we have in our
Yes.
desert where it grows
Yes.
naturally, is also wonderful.
That's my favorite one. I know it's the hardest to get a hold of, but it's one of the things I learned early on that jojoba is actually one of the closest to our natural oil production in our skin. So our body loves it. It can just be expensive to cover with. And with coconut oil, doesn't it have to be the unrefined that is better for the hydration of the skin versus the refined?
Absolutely, 100%. So
Okay.
virgin, cold pressed,
Yep.
unrefined is what you want to look for. Always organic. And what
Yeah.
you can do with the jojoba oil, because it is my favorite as well, is use it for the face. Or if you want to do body, you can do a combination
Yes.
of sunflower and jojoba, and
Mhm.
even coconut for the body too, because
Yep.
it's the virgin cold pressed isn't expensive.
And let's show our picture of the dry skin while we're talking about this. But I always warn my patients too. See, this is what that dry skin starts to show up. This is what my hands end up looking like in the winter because I wash them so often in between patients and then, with them being dry. So, the one thing I always caution my patients, I do love the use of the oils, but if you're going to put them on before you go to bed or your clothing, just be prepared that you can stain clothing. So I would usually recommend them before bed at night and make sure you're aware that whatever sheets you have going on may end up with a little bit of oil on them.
Yeah, exactly. I agree 100%. And then right after you get out of the shower is when your skin is going to want to soak in and nourish
Yep.
all that oil.
Yep.
Internally, vitamin D supplementation has been shown to help with atopic dermatitis. There may be some correlation with just low D during the winter time as well, and that's why we're seeing that it helps more. But you always want to get your vitamin D levels checked before you supplement. I typically find that most people do fine with 5,000 IU's a day,
Yep.
and they're not going to overdose on that. And then there's some really new integrative dermatology research showing that hemp seed oil, 2 teaspoons a day, or adding some hemp seeds to food can help benefit the skin barrier, and so can L-histidine, which is an amino acid, about 4 grams a day.
Okay. Those are some good ones to add in.
Right?
I do love the vitamin D, and you're right. And Dr. Sanjeev Chopra, which is Deepak Chopra's brother, and he's a professor at Harvard. He's an MD. He is also a big promoter of vitamin D, and he's the one who says even if you're not testing 4,000 IU's a day, you're never going to overdose. But
Mhm.
if you are testing and you're lower, then your doctors can monitor you for higher. But he is a big pusher of that.
Yeah, I am too over the years. I've just seen it really benefit people from energy to so many other metabolic functions.
Even just hormones. It's
Yeah,
commonly referred to as the pro hormone.
yeah, it is. It is. So more isn't necessarily better, but 5,000 is a really good starting point for most people, and 1 to 2,000 for kids is
Hmm.
where I go with that, depending on their age.
Yep, absolutely. Absolutely. All right. So now that we kind of ran through a little bit of dry skin, can you kind of explain a little bit for us what is the difference between dry skin and eczema?
Sure. Dry skin is just basically loss of the skin barrier. So we talked about the brick and mortar. So you have your
Hmm.
cells, and then you have the ceramides or the mortar in between that holds them together. And dry skin is when it's compromised. So that's where you want to add hydration, minimize soap use, avoid drying out the skin. Whereas eczema is when there's actually, we call it an allergy in the skin. So people that get it are typically those who are predisposed to allergies, asthma, and it's an inflammatory response where we call it the itch that rashes. It almost starts as an itch first, and
Yeah.
then it turns into a rash. And I find quercetin, as far as a supplement, to be it's an antihistamine without all the side effects of antihistamines, like
Hmm.
Benadryl will make you tired and hungry,
Yeah.
and quercetin typically doesn't do that. So with eczema, what we typically try to focus on is improving the skin barrier, like we just discussed, through all those strategies of minimizing soap, maximizing hydration. And then sometimes we'll need some things to kind of tampen and rebalance the immune system, and then avoidance of any allergens. But if you can imagine, if your brick and mortars, if your skin barrier is very well maintained, then less allergens are going to be able to penetrate and you're going to have less of a problem.
Mm-hmm. No, that's good. I just find that eczema can be a large problem for a lot of people, both adults and children. So that's why I always like to cover that as a topic because it's so broad. You know, people will come in and they'll say, every time I get stressed, I get this eczema outbreak on my eyelids. What do I do about it? I'm like, well, that's a huge, broad conversation we need to have. Everything from what are you eating? What are you putting on topically? And then there's the whole fact that stress, you know, can cause that to flare as well, because then it's decreasing your immune system.
Exactly, exactly. That's the thing. It's stress is always going to bring out what we're most predisposed to. And
Mhm.
it's very associated with many conditions from psoriasis to eczema. And there have been good studies showing that meditation can help, or even breathing exercises. So I always think you can breathe when you're driving or in the grocery line and help rebalance that immune system, because whether it's too strong or too weak, it can present in the skin as some sort of a dermatitis or condition. So we always want to bring it back to center line.
Yeah. No.
Cortisol will throw it off. It throws off all the hormones. It throws off, just the balance of everything. So it all comes back to being there. We're always struggling ourselves, right?
Going back to the dry skin one more time and the NMF, or natural moisturizing factor, is that something that decreases over time with age?
Yes, it absolutely does. And then the other thing is as people get older, they tend to be put on statins more frequently. And statins, or cholesterol lowering medication, can also decrease natural moisturizing factor in the cholesterol in our skin, which is important. So we need cholesterol in our skin for hydration. We need cholesterol in our brain, right? So cholesterol isn't all, it's not all bad. So yeah, it naturally decreases over time. And it takes a while to adjust in certain environments, but there are supportive things that you can do internally, like have healthy fats in the diet, avocado, olive oil, things like that, and avoiding nut seed oils, no canola, soy oil, vegetable oils. I recommend people avoid those. They're highly inflammatory and they actually make your skin inflamed, whereas healthy, supportive, supple oils can improve your skin, fish oil, things
Yep.
like that.
Yeah, that's what I was going to say. Fish, getting some good quality fish in your diet. That's always a good way to go for the oils.
Absolutely.
I
Absolutely.
think I'm gonna eat a whale.
Oh my gosh. I think that might be illegal.
That's about how much fish I need.
All right. Well, I'll bring you something that you're legally allowed to eat so we don't get in trouble over here.
I love salmon roe because they're high in krill oil and they have astaxanthin in them, which gives your skin like a nice rosy glow as well. But it's an acquired taste. You either like it or you don't.
Yeah, I think I like salmon better than I like the roe, but the
Yes.
astaxanthin, I'll just use the product we have at our office and rub it on my face.
There you
Which
go.
is amazing.
Yeah, we have an intense antioxidant product that the base of it is the astaxanthin,
Who makes it?
ABI.
Yeah, that's such a great product. I love, love that.
Yeah, you would love their product. So that one is actually what I put people on for dry skin. Because the way I always explain it to my patients is, again, you need water and you need oil in the skin. And your ceramides are kind of what help those two bind, because otherwise they don't mix, right? It's like when you put water and oil in a glass, they stay separate. Well, we always look at our serums and our practice as helping to replenish the water, and our moisturizers are the oil. And so when our patients come here from out of state and they're really dry, that intense antioxidant serum that we have is not only very hydrating, but they're getting the super potent antioxidants benefits of the astaxanthin being in there.
That's so nice. Yeah, and that's why you want to put all these things on like right after you wash or right
Yeah.
after you get out of the shower when your skin is hydrated, and then seal it in.
Yep.
Because the skin is just basically protecting your inside from the outside. So,
Mm-hmm.
it's holding in moisture. So burn patients, for instance,
Oh, yeah.
they die from like electrolyte imbalance or infection. So
Yeah.
that goes to show you the significance of the skin and protecting you from the outside, germs and microbes that we're exposed to all the time, as well as keeping our hydration and electrolyte in balance. So
Oh, yeah.
the more we can support that, we just allow our body to naturally protect itself and stay its healthiest way.
Yeah, no, absolutely.
Exactly.
Yep,
Mhm.
Larry teaches that whenever he teaches our didactic to all our new coming laser techs. He always talks about the skin and the importance of that because, the number one thing that's going to kill you besides infection when you're a burn victim is that dehydration and the electrolytes. That's the two things they struggle with those burn victims. So,
And we see it on a lower level, when we have compromise, whether it's eczema or, even with acne and things like that when there's an imbalance. So,
hmm well, speaking of acne, now that we can round that corner back into it, so let's
That
talk a
was
little bit.
perfect.
I know. Usually I'm the one reeling Larry back in, but today that happened to me. A little bit of payback. Surprised you didn't pick up on that one.
Yeah, I'm letting it go. It's early.
I
It's
know.
still early.
I
Yeah,
don't think he's awake yet.
Monday morning.
for sure.
All right. So, anyways, acne, wherever you want to dive into it, whether you want to talk about adult acne or just acne in general, let's kind of jump into that topic because I feel like that is also a broad topic, just like eczema.
It is, so there's the typical teenage acne that we really try to treat so that there's no permanent scarring and that teenagers feel better about themselves. But typically they outgrow it, right? And the
Yes.
components of that cause acne, basically, if you can imagine, changes in hormones that increase oil production. So the sebaceous glands or the oil glands in our skin, they become enlarged. And as these glands become enlarged, the pores become larger, the skin cells basically cause plugging and clogging of the area, and they become very inflamed. And then the microbes or the microbiome, we all have a natural, very healthy microbiome on our skin. It becomes imbalanced and will cause inflammation and acne and breakouts and rupture under the skin. And it presents as cystic pimples
Mm-hmm.
often, or just blackheads. And with adults, it's a little bit different. So I see a lot of adult acne, especially in women, and it presents differently rather than just the T-zone area. We're seeing more. So in this picture here, you can see open and closed comedones or
Mm-hmm.
blackheads, and then some inflammatory areas. And this is pretty classic acne. What we see in adult female hormonal acne, way more than men, is very, very deep cystic acne on the jaw, the chin, the lower part of the face. And they're tender pimples that don't have blackheads or whiteheads, and they last for like a month. And people will often try to pick them, nothing will come out, and they
Mm-hmm.
tend to be cyclic with the hormones. And what we
Yes.
find with this is that androgens or male hormones, they can be very high, but more often early in my career, I tested everyone's hormone levels, and I rarely found or abnormalities. More classically, what happens is the blood levels are normal, but the sebaceous glands, so the oil glands, they're extra sensitive. They're overly sensitive to these normal levels of circulating hormones. So what happens is we have these little catcher mitts in our cells. They're called receptors, and there's more receptors, or they're more sensitive to the normal amount of hormones, and they grasp on. And then we see, maybe some hair loss on top, maybe some extra hair on the face, maybe some hormonal acne around the jaw. PCOS kind of symptoms as well can be associated with that. So it's a different type of acne, and it has to be treated differently than regular teenage acne.
So how do you like to treat this type of acne?
Yeah, so I really like to dive into lifestyle strategies. There's,
Mm-hmm.
when I was trained, I was taught, oh, diet has nothing to do with it, and I do. I listen to my patients. So over like the last 17, 20 years, I might have someone who's well controlled, and then I find out they go home and they have, certain things over the holidays, or so, there were all these little clues as to what has been going on. And I was always interested in nutrition. And
Mm-hmm.
now there's good research showing that there are certain things that can make acne worse.
Yes.
Dairy's highly, go ahead, Anne.
No, I was going to say yes. I totally agree with you. Dairy's one huge one.
It is, and I used to do fitness competitions, and a lot of people would have breakouts. And I think some of it has to do with the high cortisol, what we talked about earlier, disrupting the hormone balance. Also, a lot of the whey protein and the casein protein,
Yes.
that you might not be having dairy, but you're having those proteins and the protein bars with that in it. They can be inflammatory, not in everyone,
Mm-hmm.
and it's not necessarily just that dairy is inflammatory, but it produces IGF, which is sort of just a a growth sort of hormone. If you want to think of it that way, it makes things kind of grow and become inflamed. And then high glycemic index foods. So what does that mean? Sugary foods,
Sugar.
processed foods, flour. Your body sees pasta and it converts it into sugar. It sees rice, it converts it into sugar very quickly. And that bump in your bloodstream of sugar is associated with acne. And then, as we mentioned earlier, the nut seed oil. So check all the labels looking for canola, soy, all the cheap oils basically are going to cause inflammation in your skin. So those are things I talk about with all of my patients. And then I try to get them away from plastics and other xenoestrogens. So we have these things in our environment that have really piled up over the years, and they throw off the hormonal balance in our body. And we do have the ability to clean them out, but what we need to do is avoid them so we can help our body clean them out. So every time I drink out of something, it's going to be, something metal or something glass. I'm a little clumsy, so I don't use glass, but
I'm with you on that one. My big metal water bottle, I have one of those iron flasks, has a huge dent in it from me dropping it, but hey, it still works.
So many, but avoiding the plastic. And then also with food, use glass containers or metal containers, and really try to avoid as much plastic as you can. I don't grab the receipts from the grocery store because they've got phthalates on them. And especially if you have hand sanitizer, things do get absorbed through the skin, and they build up over time. We've found plastics in the Arctic, where no one lives. So just piles and piles up. So I have a big problem with plastics. And then pesticides as well can cause hormonal disruptions. So the EWG has, a good site, Dirty Dozen, and those are the ones you definitely want to avoid as far as doing organic only. I try to do organic everything just to support the industry, but price comes to play, and you want to definitely stay away from the ones that are going to cause the most problems. So that's how I start. And then I also use medical things. So I like a medication called spironolactone, and I often will use spironolactone, which basically blocks those little catcher mitts. So it helps to get results quicker before the body can kind of clean it out. So we get that little immediate gratification, and then as someone is clear, I taper them off the spironolactone. And now there's a topical form as well. It's not covered by most insurances. I can never say the word. It's like a cycloprotone or something like that. But there's a topical form of the spironolactone. But I've used the spironolactone for 20 years, and it works great. And I could usually get people off of it within 6 months if they follow the lifestyle strategies.
No, it's interesting because going back to the foods, when I was early on in this industry, one of the dermatologists out here, Dr. Jody Comstock, I was watching her do an injectable training, but the patient in the chair had acne. And it's funny, this is why I love her. She's like, I know you're here to get some fillers. She goes, but I need to talk to you about your skin. And she's like, the three things she pulled, she goes, I want you to get rid of dairy, peanuts, and soy in your diet. So if one of these three is a staple, those are the first things I'm going to ask you to remove. And then she did go through some other big skincare stuff. And it's something that people forget about it. And, they're getting rid of dairy. So they're like, oh, I'll go to soy milk. But just like you were talking about xenoestrogens, pretty much all soy in the United States is going to be GMO. So it's actually higher in those phytoestrogens, which are not the proper phytoestrogen that's normally in soy. So people need to choose another type of dairy. And then peanuts, as you and I know, it's a legume. It's not a nut. It has a totally different kind of very inflammatory oil in it. And so if they're big on eating nuts and seeds, or they're vegetarian or vegan or something, I just get them off the peanuts. Let's scale back. Let's use a different kind of nut instead of the peanut.
Are there any that you like more than others? I mean, it's hard for me to even imagine people have peanuts nowadays with the aflatoxin. They're so dirty. So I even forget to give that advice. I'm going to have to add that in my list of things.
Peanut butter is still so positive. I love almond butter and pecan butter. Those are like my two go-tos.
Oh, pecan is so sweet. It's delicious. Okay. That's great. So then there's some supplements as well that I like. I don't want people to just go out and start taking these supplements because they're very fine-tuned depending on what is going on with you. But one of them is DIM,
Yes.
Yeah, I'm sure
I'm glad you brought up that, because I was going to talk to you about DIM, calcium D-glucarate, and saw palmetto. But let's start with DIM.
Okay, so DIM basically, it plays a significant role in estrogen metabolism
Mm-hmm.
and balancing the estrogen in the body. So it doesn't block estrogen per se, but
Mm-hmm.
it helps to balance the good estrogen, which are like the two OH. You probably know this better than
Yep.
I do.
Yep.
The
E1
bad
and E2 and E3. So,
exactly. Okay, so that and it can also help reduce inflammation.
mm-hmm.
And it also inhibits aromatase. So aromatase converts testosterone into estrogen.
Yep.
And some people who have higher testosterone, DIM can make the acne actually worse. So you don't want to use it in everyone. It's not a cure-all. It has to be finely attuned.
Mm-hmm.
You know what somebody's metabolic profile
Yep.
is.
Yeah. Looking at their blood work, things like that. It's interesting that you say that because I do love DIM for those reasons, and I think it can be beneficial. One of the things I've learned, because we do a lot of bioidentical hormone replacement, and so DIM can be very popular, especially in men. If you've ran their blood at 5 weeks, post hormone supplementation, and they tend to be converting into estrogen, we really try to stay away from some of the medications, and DIM is an easy one to be able to put them on. But it can sometimes, if you're taking higher doses of it, turn your urine slightly reddish.
Oh, I know that.
it
Really?
it doesn't hurt you, but you need to tell the patients because they freak out if they are not aware.
Wow. What dose are you seeing that?
600 milligrams, we'll have them do it twice a day. So if they're on it once a day, sometimes it doesn't happen. But if they're on it twice a day, we have seen it happen in certain people. And it is, if you research on it, it is a side effect.
What's the red?
I don't remember. I don't remember that part. I'd have to look a little bit more. But it's not going to cause a problem to the patient. You just want to tell them because otherwise they might think that they have a urinary tract infection.
Right? Yeah, that's great. I had no idea. I don't usually go that high with my dosing.
Mm-hmm.
I'll send them off to, my naturopath friends at that point. And
Mm-hmm.
I wonder if, so it comes from cruciferous vegetables. So I
Yep.
wonder if something like the betaine in like beets, that are
Maybe.
causing the redness. I'm curious. Oh, I'm
Yeah.
really going to do a deep dive on that. That's super interesting. Okay, so how do you use the calcium D-glucarate? Because I usually don't use that. I do use saw palmetto, but I don't
Yes.
use the calcium
So
D-glucarate.
calcium D-glucarate is also going to help with estrogen metabolism. And it's one of those where people don't realize it. It comes back to where first I'm going to talk to them about fiber and healthy eating and regular bowel movements. That, once your estrogen is broken down in your body puts the broken down byproducts, into your colon for you to excrete out of your body. But if you're not having regular bowel movements, you'll actually reabsorb it and turn it back into more estrogen. And calcium glucarate is helping to bind the byproducts of estrogen and remove them from the body. So it's an extra estrogen clearance for people who are really high. So obviously my postmenopausal women who are suffering symptoms of that, this is not one we'd put them on. This is going to be more for the women who have a lot of estrogen.
Mm-hmm.
And it's a
Okay.
liver support as well. So it's that
Right.
detoxification pathway.
Yeah. So, I mean, what we're not saying that estrogen is bad here for
No,
those
no.
that are listening. It's very good. It helps you
Mm-hmm.
maintain that attractive, like 0.7 ratio between your waist and your times when it's off
The
balance. So
curves.
exactly. Everything with life is about balance of hormones, balance of immune system. It's not good or bad to
Mm-hmm.
be at a certain point. Okay, and then saw palmetto, basically what that does is it's been used for years for men with
Mm-hmm.
benign prostatic hyperplasia or, like the
Mm-hmm.
swollen prostate where they have problems peeing, and they have to get up at night and they have interrupted urine streams. And it also helps with hair. And we also find that it can help in sort of testosterone dominant states
Yes.
because it helps decrease the testosterone from becoming DHT, which is
Mm-hmm.
dihydroxytestosterone.
Yep.
And it at the cellular level, at those little catcher mitts. So
Mm-hmm.
it blocks, it inhibits 5-alpha reductase types 1 and 2,
Yeah.
which, 2 is the one for hair and 1 is the one for oil glands. So we kind of want both of that if someone develops hair where they don't want it, loss of hair where they do want it, and then acne and oil where they don't want it.
Mm-hmm. And for my male patients, especially when we're doing bioidentical hormone replacement, finasteride can have some nasty side effects that they don't like. So saw palmetto is a lot easier to talk them into that doesn't tend to have those side effects.
Yeah, finasteride you might have heard of. It's the brand name is Propecia, and we've used it for years and years for hair loss, male pattern hair loss. Not so much in women. If the woman's postmenopausal, we can use it. But for men, some of the side effects can be breast development called gynecomastia, or just low sex drive, and that's not, you might look good, but then you, you don't have
But then
sex.
it doesn't work downstairs.
Yeah, exactly. So, it doesn't happen in everyone, but you need to be aware of this. So that's why saw palmetto is like a nice starting point.
Which is, it's funny because we do hair grafting in our practice and we talk to guys about different things, and if you let them know side effects, pretty much all of them are like, I'd rather be bald than have that happen.
Exactly. So I have a good pearl though, from the Integrative Dermatology Symposium this year. So talking about blocking 5-alpha reductase pathway, a topical pumpkin seed oil does this naturally. So it can
Really?
be used on the scalp, it can be used on the face. And typically, I recommend most oils, whether they're essential oils, or very strong oils, be diluted. So for spot treatment, if someone's going to spot treat acne, tea tree oil works great, but you don't want to put it on your skin directly.
Yeah.
So what we recommend is 20 drops in 1 ounce of pumpkin seed oil. So it's a really good spot reductor. If you have, those big, tender, juicy acne pimples on the face, you take 20 drops of tea tree oil into 1 ounce of pumpkin seed oil.
That's an excellent tip. So I haven't heard about that one with the pumpkin seed oil.
No, it's nice. It's quite a few studies out there. And then, we always talk about probiotics and helping the gut microbiome, because the gut, brain, skin axis are all interrelated. And the difficulty over the years is knowing what probiotics actually help. But in the case of acne, we are finding that Lactobacillus rhamnosus, rhamnosus, SP1 subtype, can help for acne specifically. I always think the more variety, the better, and then do prebiotics and postbiotics as well, and get it from food.
Yeah, we definitely carry the one in our office that has multiple strains in it so that they're not just on, 1 or 2 strains of the probiotics.
Yeah, exactly.
So while we're still talking about acne, I want to bring up, what is the difference between somebody who has rosacea type acne versus a regular acne or adult acne?
Okay, that's a great question, because a lot of times people say I have acne and then I look at them and it's clearly rosacea. So the big difference, the big defining characteristic is that in rosacea, you will not get blackheads and whiteheads.
Okay.
Black in particular. Let's focus on blackheads. You will not get blackheads with rosacea. The other thing is rosacea tends to be 20s, 30s, 40s, not teenagers, Northern European descent. And although I see Hispanic patients with it, and it can be a little bit more pigmentation, you don't see the redness as much. Even in my African American patients, I see it, but it's more common in those of Northern European descent. And it's central face. So forehead, nose, the medial cheeks, and the chin. It really, you need to take a step back and you just see those areas affected primarily. There's 3 different types of rosacea. So there's erythematotelangiectatic, where you just have flushing, redness, blood vessel formation, and you need, this well, you need lasers and devices to treat that.
It's like our stage 1, basically.
Exactly. Then there's and it doesn't always progress. Sometimes people will have one type and not have another type. And I actually have that type. So if I go from the cold weather into a room with a fireplace and have a glass of wine, I'm red for hours. Forget it. So we all have certain triggers, and you just want to avoid those triggers, basically. Then there's papulopustular rosacea, which I find to be the easiest to treat. And that's when you get kind of breakouts. It looks like breakouts on the central part of your face, forehead, central face, chin. Not all areas. It could sometimes just be really persistent on the forehead. And then you can get rhinophyma, which people will often say like W. C. Fields nose. That's very difficult to treat. So you want to address that early.
No, and I always teach my rosacea patients, because I have rosacea as well, is the best thing you can do is maintenance. Whether it's your photofacials, whether it's your RF microneedling, whether it's your topical products, or most important, sun avoidance, and reducing as many triggers as possible once you figure out what they are. Keeping it in control can also help prevent it from getting worse or progressing.
Absolutely. Yeah, absolutely. And I find that once the inflammation is well controlled, you don't have as many episodes. So you kind of have to be really, really hardcore and, and rigid and regimented initially. And then what happens is your skin doesn't turn on as quickly. And then retinoids, we love retinoids like Retin-A and retinols for anti-aging and for acne. They can make rosacea worse initially, but if you use them very slowly over time, they actually help stabilize that vasodilation or the redness in the
Yep.
skin. So I do use retinoids when somebody starts to become stable because I find long-term it helps them to become even more stable.
Yeah, I love it. I was at a training class last week at our office, and one of the injectors there said that one of the tricks that she's learned over the years is using hyper diluted neuromodulators, and it actually creates vasoconstriction in really hard to treat areas. So I'm going to have to test that theory out.
How did she use it?
So she's, doing like a 4-to-1 or a 10-to-1 dilution with a neuromodulator and doing just little tiny microdot injections over the area, and it's reducing the redness.
Yeah,
So she
yeah.
couldn't really tell me what the mechanism of action was, but it's a very hyper diluted, very low dose. So you are very superficial in the skin with it to decrease redness in rosacea patients that you struggle with anything else to decrease it. And
Yeah.
again, I don't know if it's true. Like I said, I'm going to try it out and see. But
No, I haven't seen the studies. For me, I'm wondering how you do the procedure, like if it's with that Aquagold device or
no,
how
she was using the traditional insulin syringes and just injecting very superficial, very tiny blebs.
it's a
So
lot
it's
of.
going to be like your 0.01 to 0.02 mLs on like a 10-to-1 dilution.
There are studies, I think they're out of Korea showing this.
Okay.
I'd have to review the literature, but I know I've seen these studies and I don't know if it helps something with the musculature of the vessels not become
Mm-hmm.
so vasodilated. I'm not really sure, but it's inflammation. So
Yes.
rosacea 100% of the time is associated with an unhealthy gut. So you need to go back to real food,
Yes.
healthy food, adding pre, pro, postbiotics.
Mm-hmm.
And you might have a little war going on until you get there, but you need to focus on the gut, avoid those proton pump inhibitors, which
Yeah.
just as bad as plastic as far as I'm concerned.
Yeah, and to be honest, most rosacea people are actually probably low acid, not high acid, and then you get that reflux, which makes them think they're high acid. So I agree. You need to get digestive enzymes in there and get off the PPIs.
Right. Yeah, it's hard because you get that rebound, when you get off of them.
Mm-hmm.
So I know this firsthand. I was on them many years ago. So yeah.
Cool.
Yeah, so a lot of times, with the masks, we've seen a lot of breakouts on the face as well. And there's a couple things going on with that. There's, the regular acne, but anytime we see friction and occlusion, I see it in my athletes in their groin, you get the butt knee or the back knee. So anytime there's friction and occlusion, so blocking of the glands from extruding toxins, which they do, and then friction, rubbing, irritating, inflaming, you're going to have more breakouts as well. So we've seen that a lot with maskne. And then the other thing is that we have about 90% of our microbiome, or the healthy bacteria and microbes on our skin, germs, are basically our healthy germs. They're by bacteria, about 90%, and 10% of the time they're yeast. And
Hmm.
the masks, what we're seeing is there's higher humidity and then there's an overgrowth of yeast. So we're seeing kind of a yeast acne, which we used to call Hittersporum folliculitis, and now we call it malassezia. And they're both the same thing. One's just in, the yeast form, and they're just in different forms, basically the same organism, but we call it, here you go.
Yep.
Okay, so in this picture here, thank you. So in this picture, they're very monomorphic. So with monomorphic, we describe it as all the spots look kind of the same. So if you look at that other acne picture we had previously, we had small sizes, large sizes, some whiteheads, some deep nodules, some blackheads, everything looked different, but this is very monomorphic. It looks very, very similar and it's evenly spaced. And that's how I clinically can tell that it's the malassezia folliculitis or acne, the yeast acne, versus regular acne. And then under the microscope, I can just take a little sample of like one of those whiteheads, and I don't have to cut. I just do a small little scrape, and I can see they look like little tennis rackets under the microscope, and we can tell that that's an overgrowth of that. And it happens under if you're putting olive oil on your skin, if you're having highly inflammatory fats, if you're having too much moisture, or if you took a lot of antibiotics. So patients that have been on antibiotics for months and months and months, and now they're having a new type of acne, I say, things are out of balance. let's take a look. Now they have yeast acne because the healthy bacteria were all killed off. So that's what can happen as well.
Yeah, and no, and that's important because you're right. Patients will show up and have different presentations of what's going on, and that's always my favorite question to ask when it's something new is, what has been going on in the 6 months before this showed up, and and the 30 days before it started to happen, and all those things, because then you can start to pinpoint like, oh, you had 3 sinus infections and you were on 4 rounds of antibiotics to clear them, and then all of a sudden you have acne.
Right, exactly, exactly. Or they were, in Costa Rica or something,
Yeah.
right? or even better, what I see frequently when I was in residency, I rotated through the Mayo Clinic here in Scottsdale, and we started to culture all of our acne patients, and we found a lot of weird bacteria, especially in people who are using reusable facial devices, like those loofahs or things that you keep in the shower. They just harbor so many different
Or the
bizarre.
mechanical scrubber brushes.
Exactly. And then they stay moist all the time. And then you scrub your face and you're just reintroducing and pushing these bacteria and yeast down deep into the skin where they cause real problems, where they might not have caused problems on the outside of the skin.
Yep. No, you're absolutely right. That's a big one, is to kind of go through all of their habits with them, but remind them, that if you're using something like that over and over again without cleansing it regularly, there's probably stuff growing in it.
Right. What are your thoughts on Clarisonic? Do you use that?
No, I don't. For me, number one, being a rosacea person, I found it was a little too harsh. I do have very sensitive skin. So,
Yeah, I like it. I like it. And I think I'm becoming the minority.
yeah.
So I used it for so long. And the older I get, the more I love exfoliation, because I feel like we need to get those layers off. There's many ways to do it. Mechanical is really the least favorite way.
Yeah.
I don't necessarily recommend it so much anymore, but I do
Yeah.
use it personally.
See, I'm the rosacea patient who loves Retin-A. So I use that at least 4 to 5 times a week. And I think that's where I'm getting my exfoliation from, is there. So I don't really feel like I need the mechanical.
Right. See, so for those of you listening, you're realizing that like there's so many ways to go about it. That's why a personalized plan is so important. So we're giving you some ideas on what's out there, but the last thing I want people to do is really go and just start taking all these supplements. I mean, you can do the pumpkin seed oil, that's always good too, or on the top of the head too for hair loss. I like it there as well. So there's some things that are, generally safe for everyone, but really for most people, it's just a bespoke, personalized plan, because we're all individuals with different genetic variations and different lifestyles, and that's why it has to be focused that way.
What do you think about that, Larry?
I'm all for it.
I feel like he's sitting quietly over here. I'm not sure if he's sleeping.
You two have done a great job. I mean, I didn't know where to add anything.
But really, what would Larry do after all this?
Well, we did not cover some of the treatments that happen in offices that are where patients come in with acne, and once upon a time we used to do a lot of Levulin, PhD. We did all kinds of different things, and now we have new technology for that. Do you want to discuss any of those?
Sure. I mean, I think you're better to discuss the technology than I am. You guys are the pros at that. There's little blue light devices that people have used at home that work for acne, but I mean, nothing at home is ever going to be as strong as what you do in the office. You're not doing Levulin anymore, are you?
A little bit. It's become so expensive.
That's the problem. It's effective, but the price point is just, I think the cost versus the benefits are a little outweighed because of the price. But
we tend to use the Agnes.
Yeah.
So Larry can tell us about the Agnes.
I think we've even done a podcast on it, haven't we?
Yes, we have.
Yeah. The Agnes is a great device. It's a radio frequency device that our technicians use. And you can go literally right down the pore, if you will, and destroy the sebaceous gland. So when you have active acne, you know where the problem is, and they can go in and literally kill the acne, the sebaceous glands that are causing the acne. And over a series of 2 or 3 of those, typically you get, a very high success rate. So that's more of a permanent solution. But it's another solution, and it works well. I know there are systems with microneedling RF that are being used more and more for that. And so there is a lot of technology out there now that people are looking at. And again, I think red light, blue light, all of that kind of stuff is fantastic.
Yep.
So we use that in the clinic all the time.
Yeah,
I
but
love the Agnes for sebaceous hyperplasia. So the overgrowth of
yes.
the oil glands,
Right.
they're kind of little yellow globules that typically middle-aged men will get on their central part of their face. And and they're very, very, very hard to treat. And the Agnes is amazing for
Yes.
that. I love it. I love
Yeah.
it so much. And I find it interesting. There's a few things that just after going through medical school and knowing what I know about medicine, like what purpose do the oil glands even have? I mean, they're not hydrating our skin because we're, maybe a little bit, but not for the problems they cause, right? So I think getting rid of them a little bit is not going to be that harmful,
Well,
in the long term.
especially since we have like millions of them, that
Yeah.
if we selectively pick off and destroy the ones that are causing problems, it's not like you have no oil glands left.
Exactly. So central part of the face, if someone has large pores, does the Agnes help for that as well?
Yes. Yeah,
Yes.
there's actually tips and special settings for that. But I
Yeah.
find that there's two types of large pores. There's the ones that are really, really big that I tend to see more often in men, and I will use the Agnes. If they're finer, like the way that I feel my pores are large, but some people would look at me and think, no, yours really aren't that large, we tend to prefer the Moxie or the Halo to close those ones down versus actually going in with the tip. But there is a specific blackhead tip versus a comedone or an inflammatory acne tip with the Agnes. So the Agnes was developed by Dr. On, who is a dermatologist, and his goal in life was to find a permanent cure for acne that didn't have systemic side effects.
Yeah, I mean, that's always the goal because the thing about acne is, it's so common, but it doesn't mean it's not significant in how it affects somebody's interactions.
Yes.
And I find it's transformative when I treat people's acne and, how much more they feel confident to accomplish things in their job or school or, personal interactions. It changes a lot, and it's kind of heartbreaking that it holds people back. But on the other hand,
Yeah.
it's great that, when it's treated, it moves people forward.
Yep.
Yeah, the percentage of people that actually come in for that versus just, living with it is shocking. I don't understand why more people don't come in, take a look, see what you can do, and talk to an expert on it because there are a lot of people out there that just don't do anything for it at all. It's a
Yeah.
shame.
Well, and the reason there's so many treatments is because not one treatment works for everyone. So
Right.
Yes.
often I'll see that people say, I tried everything, but it might be everything over the counter. That's why I think it's so important that you're doing this podcast to bring awareness to all the options that are available because it's just a matter of finding the right thing for you, and these free podcasts are so educational so that people can realize like what is out there.
Right.
And once you know it's out there, you know it's available, you can look for it. If you don't know it, you don't know it. You don't know what you don't know.
That's right. That's right.
I know what you already know, though.
And people come in asking questions, and it's like, well, why weren't you here a year ago or 2 years? It's like they wait so long, and then usually the problem is worse. So
Yeah.
we have to do
Right.
more.
So if you're listening to this, share this with someone who you think needs it.
Yeah. Well, get them in. A lot of this stuff is pretty easy to calm down. It doesn't mean you don't have to work at it and you don't have to actively participate, but a lot of it makes such a difference to them. It's a game changer for them, and I'm always surprised that they don't do it. When they finally come in, it's like, oh my God, where have you been? So anyway.
Well, and it's not an all or nothing approach. There's stepwise things that you can do. Some things are free, some things cost a lot, and it doesn't have to be all or nothing. You don't have to think that it's unattainable because it might be an expensive technology. Because I always think if you don't get that coffee every day, within a few months you have money for the treatment. It's that compound effect, right?
Absolutely.
Yep, that's correct.
Good. Well, I think that's going to wrap us up for today, unless either of you have any last words of advice for our listeners out there.
No, I had so much fun. Thank you for having me.
Yes, no, thank you for joining us today, Dr. Haley. And we will connect her information with ours. So if you guys would like to reach out to her or to us, we will get some stuff posted up on our podcast. But thank you all for joining us, and we'll see you next time.